Dislocation of patella or kneecap occurs when patella slips out of the groove where it sits normally on the femur. So this is the anatomy. We have a knee joint and the patellofemoral joint. This is the groove where patella sits on the femur. Now in case of dislocation, patella slips out of this groove and clinically this kind of picture appears. Laterally, patella slips out of the groove and this is where we can see the patella on the lateral side instead on the center. Now, causes of patellar dislocation. Dislocation occur due to a number of reasons. The very first is the trauma. Now, any direct blow on the patella or twisting injuries, especially in sports, result into patellar dislocation. There are some anatomical factors, especially the large Q angle. Q angle is actually the angle between the quadricep muscle and the patellar tendon. If this angle is more, there are chances of patellar dislocation. Some congenital conditions like Larsen syndrome, arthrogryposis, and diastrophic dysplasia. All these conditions are associated with the patellar dislocations as they promote some form of joint laxity and results into dislocation of patella. So let's discuss acute dislocation in detail first. So acute dislocation of patella results from the sudden contraction of the quadricep. As you can see here, sudden contraction of the quadricep while the knee is flexed or semi-flexed. So often seen in sports. So patella dislocates laterally. Patella always dislocates laterally. Clinical features are the effusion, as you can appreciate here. Obvious deformity, one can see the roundness on the lateral side. Tenderness anterior-medially. This is due to the stretching or the rupture of the capsule which is present on the medial side. And patient unable to straighten the knee until it is reduced. So these are the clinical features that we see. Treatment. Sometimes dislocation reduces spontaneously, but it is sometimes. But most of the times reduction needs to be done. So in case of reduction, a medialward pressure, as you can see here in the image, a medialward pressure is being applied by the surgeon on the patella while the knee is straightened. So this is how it is reduced. Once it is done, an above knee POP cast is given to the patient for around 3 to 4 weeks, which is then followed by mobilization. Now sometimes we see, as you can appreciate here, there is a small chip. Now this small chip is intra-articular and this is known as the osteochondral fragment. Now this osteochondral fragment actually is a piece of a bone which is covered with the articular cartilage. So sometimes this osteochondral fragment may be shaved off either from the patella or from the femoral condyle at the time of dislocation. Now if this fragment is present, if this fragment is shaved off, it will result into repeated episodes of pain. Patient will complain that there is a pain in the joint, swelling, and patient always get a sensation of a loose body inside the joint. So once it is diagnosed, arthroscopic removal of this is required. I hope you like the video. In case if you like the video, do like, share and subscribe the channel.